ethics, and these have a voiceover. So if you ever want to watch these slides on your own, feel free to do that. I've provided what we call a voiceover here. So nursing as a profession, who are we? What are we? How do we define ourselves? Well, for centuries, nurses have practiced at the bedside. And I would say over the past the last century, there's been more work about formalizing nursing as a profession and reminding ourselves that during the evolution of the professional development, we really worked at creating the professional rank alongside our interprofessional colleagues in the hospital by building our science, the science of nursing practice, and building it and basing it on nursing theory. So I've seen in my 40 years as a nurse, more and more investment in the development of nursing as a science and the theories that guide our practice. Several nursing scholars have written theories, and these theories inform the professional practice of nursing. Some of them that I know of, and that if you have others that you could share, are Dr. Barbara Rogers and Dr. Dorothy Oram. Those two women have set forth theories that guide professional practice and that nurses use in developing interventions, developing programs, conducting research in the area of nursing science. And so it's a combination of both theory and science that situates nursing as a profession. Nursing as a profession is also guided by a code of ethics. And these codes of ethics are written by various organizations. The organization I'm going to reference today is the International Council of Nurses. And I chose that because that organization oversees global. So they have a global lens and a global reach. And for us here working in the United States and you working in Sierra Leone, they bring us together under one code for international practice. I will share with you in the United States, specifically in Massachusetts, we have our own code of ethics that we've written. The American Nurses Association has written a code of ethics that guides practice here in the United States. It's quite complementary to the International Council of Nurses, and yet it's unique to the United States. It would be interesting to hear from you if Sierra Leone, if your country has set forth a code of ethics for your practice. But nurses are regulated. In our jobs and in our professional practice, we're regulated where I've identified three lenses to think about regulation. One being professional associations and organizations. For us in the United States, it would be the the American Nurses Association. Also, the International Council of Nurses sets forth guidelines that we refer to. And so professional associations will give us regulatory guidelines. Governments give us regulatory guidelines. In fact, we are licensed here in Massachusetts. I'm licensed by the State Board of Registration of Nurses. And that state board regulates my practice. I am held to the standards that they set forth, and they are mandating certain educational standards and frequency of nursing education. I need to complete a certain number of continuing education units every 2 years in order to renew my license. And those are all regulations set forth by the Massachusetts State Board of Nursing that guides my practice. Now, in Sierra Leone, there'll be regulations derived from your government officials. And I know that I've spoken to Vicki Reed about some evolving regulations that are coming forth. And so we all practice within the structures where we work. And then, of course, our health organizations, the institutions where we work, they guide our practice and they set forth regulations. Here at Mass College of Pharmacy, I have faculty standards that I need to abide by. And Professor Myatt and I will talk about when we're at the hospitals. She's working at Boston Medical Center. I've worked also at Children's Hospital in Boston when I worked there. we had regulations set forth by the hospital for the nurses' practice. So 3 lenses to think about when we think about regulation: professional associations, government policies and rules, and our healthcare organizations where we work. Any questions? So I know you're familiar with the nurse's oath. I've spoken to several of your colleagues from the first cohort, and I've spoken to Vicki Reed about this. This is something that holds us all together. It's something we all share. It is named in honor of Florence Nightingale. Several of us have had this at our graduation ceremonies or our pinnings or award ceremonies. It's a modified Hippocratic oath, and it speaks to our practice and our commitment to our practice. It was composed, I did some research, it was composed in 1893. Isn't that amazing? By a nurse in the Detroit Training School. It's recognized by international, national, and regional nursing organizations. But what I wanted to share with you is that recently we've seen some updates to this oath. And the updates seem to be very specific to the area of practice, and we'll talk about that a little bit. But let's just look at it up close. So this is it. And you might all recall this from your own practice and your own graduation ceremonies. But these are the words put forth in 1893. I solemnly pledge myself before God. Let me just close out my picture here so I can see it all. Before God and in the presence of this assembly, to pass my life in purity and to practice my profession faithfully. I will abstain from whatever is deleterious and mischievous, and will not take or knowingly administer any harmful drug. I will do all in my power to maintain and elevate the standard of my profession, and will hold in confidence all personal matters committed to my keeping and all family affairs coming to my knowledge in the practice of my calling. With loyalty will I endeavor to aid the physician in his work and devote myself to the welfare of those committed to my care. So it really gives you a moment to think about the code that really has held itself since 1893 to today in so many of our settings. And yet here in Massachusetts, the Massachusetts Nurses Association took it upon themselves to modify it. Now, this is very dense. This is not a slide I normally present, but I couldn't really cut this up. But I wanted to show you that there have been some changes to this pledge put forth by our Nurses Association. And again, it's specific to Massachusetts Nurses Association. So we're not saying that this is the pledge for the world. We're just saying here in Massachusetts, we wanted to update it. And this was updated for the 21st century. And what they've done here is they've kept several of the components of the oath. They've committed to the healing profession. They maintain the ethical principles. They talk about privacy and protection, but they talk about human rights of our patients and human rights of nurses themselves as individuals. They talk about the ethical principles that we'll go over in a little bit. They talk about collaboration, social justice, equity, an endeavor to mentor, to continue to learn, to grow. And so they've expanded this oath for themselves. So I wanted us just to reflect for a minute. I'm going to go back one slide. And I'd love you to all think about amongst yourselves and maybe talk to the person sitting next to you, how you might rephrase some of the statements here, or update this for the nurses working in your healthcare organization. What sort of updates would you include or incorporate into the Florence Nightingale Pledge to meet the practice of today for you all in Sierra Leone? So maybe take a moment, talk to your neighbor, the person sitting next to you, and think about what words might you add to this, what concepts might you expand. Where do you think the modifications might be in this oath? And I'll give you a few minutes to do this because I think this is a really worthwhile activity for you to participate in. This oath.
So, are you ready to share? Are you ready? Not yet.
Not yet. Okay. Okay. I'll move forward and let them see the updated one from Massachusetts to see some ideas. And these were some of the changes that we made. I can't take credit for it, but it's really well done. Seeing even their focus on planetary health is interesting here.
So remember what they said. Introduce yourself and then you present.
And if you could speak,
where you're working, then you present.
speak right into the microphone as best you can. It really helps us hear.
Can you hear me? I am Mohammed Momo.
Yes, I can hear you.
Okay, fine. I'm Mohammed Momo, presently working at the SBU department. Special maybe PIH at PIH. So we have had few slides to the nursing blend that was presented to us. So I have 5 slides here. I will read them. Okay. So just 5 things to at least add to the blend. We have that chance to add. So the first one I will say is we add so help me God, because with all those oaths you need God by your side. So add so God help me or so help me God. Then the second, we add good attitude towards our patients. That's in terms of communication, how we communicate with patients, not patient relationship, how we communicate to them. The third also, we will not only cooperate with the physicians, we we need to cooperate with other health or allied professionals and other health workers. We need to cooperate with them. And yeah, as a team, right? We have to serve as a role model to those coming after us. Yeah, everything professional. And also, the last one I have here, we don't need to be judgmental. We don't just pass judgment on patients. So we have this 5 relations to add to the play. Thank you.
Thank you. Thank you very much. That's very, very thoughtful. And, I hope it is the base from which you can take this exercise and maybe work within your program, within your nursing staff to work towards an oath that is unique to your setting and that you all agree to and come together for. I think it would be really worthwhile as an exercise for the nursing staff to come together and look and commit to that oath. The principles and comments you added are so beautiful and so important and impactful to your practice. Thank you for sharing.
Thank you.
Any other thoughts?
Introduce yourself.
I was talking about the therapeutic relationship
I can't hear you as well. Thank you.
Yeah. I'm Alice Adona, presently working at the male surgical ward. I was talking about the therapeutic relationship between or therapeutic menu between simply that the privacy for the patient. Some patients have some kind of privacy. You need to
Yes.
discuss with them. Only personal things with them. I need them to add there. Because, for example, if you say we're talking about therapeutic relationship, it's between you, the patient, and the patient relative. So I want them to add that one there. That if you have therapeutic relationship with them, confidentiality. Yes, let me say something. It's already here. I hold in confidence all personal matters committed to my duty and all family affairs subject to my knowledge in the practice of my time. So you're not the confidentiality I'm talking about. When I'm talking about therapeutic relationship, like friends, you have friends with you friends with your yes, patient. Non-patient relationship. That is non-patient relationship.
So I think your comment about privacy and patience is so important, and it really will take us into the next several slides and really be a guiding principle of the ethics that guide nursing practice. So let's talk a little bit about what is ethics and why we abide by a code of ethics. So ethics is a specialized area of philosophy dating back to ancient Greece or even earlier. The concepts of Hippocrates still inform today's ethical issues. He was one of the first writers in this field that was recorded. But ethics is a systematic study of what is right and good, measured against principles, virtues, and core values of a profession. So several professions have codes of ethics. Specific today, we'll speak about the code of ethics that guides nursing practice. And the scope of nursing ethics deals with character, what sort of person one ought to be as a nurse, and conduct, how we should act. It is not a code of character, nor is it a code of conduct. Rather, it deals with the duties and obligations of nurses to patients, to other healthcare professionals, including all of our staff members at the hospital, those who work in the laboratories, those who work in the kitchen, those who work as aides to our nursing staff, physicians, therapists, all together, that team comes together, nutritionists, who's ever working together within the healthcare professional practice. But we also have duties and obligations to the profession itself, to the wider public, and to global humanity. And this scope of nursing ethics is set forth in the International Code of Nursing Ethics. So it's not specific to my thinking, but it truly is what's been determined by the higher authorities in setting forth nursing ethics. So why do we have one? Why would nurses need a code of ethics? Well, first of all, nurses are a profession. We're a profession that needs the recognition, the stature, and the rigor of professional codes of ethics. We also serve vulnerable populations, so therefore we need to be guided by a code of ethics. We promise to protect patients in our practice. We impact patient well-being. We have a very, very important role to play in the patient care setting, in the healthcare organization, and in society in general. We are really important and trusted members of our society. We have a moral relationship with patients that gives rise to ethical obligations. And we depend on the public to trust us. When you think about a person who encounters or comes into the hospital setting, they come in without knowing us personally. They don't know our professional background. They don't know our experience, but they do trust us, knowing that we're nurses. In fact, here in the United States, there's been some surveys and polls done, and nurses for the past 20 years have earned the highest ranking of any profession in our country as the #1 most trusted professional, not healthcare professional only, but professional in the United States. The public trusts us. People who come into our healthcare organizations knowing we are nurses trust us. And therefore, we need to be held to the highest standard of professional practice. And this code of ethics guides that practice. So it's an identifying feature of a profession. It actually is a requirement of a professional practice. So in so many times when nurses were really trying to get the recognition as professionals, it was principles such as and practices such as having a code of ethics that set forth a professional model. Along with the science and the theory, these components strengthen the profession within the broader professional arena. We facilitate professional self-regulation and accountability by having a code of ethics. We describe the obligations, like so many of you just described this morning, of the nurse to patient relationship and the nurse to professional collegial relationships. Those are really important. And again, when we say professional colleague, we're talking about an interprofessional lens. All of the health professionals who work together to care for patients. And this code of ethics serves as a guide for analysis, decision, and action. In fact, in some settings, we sometimes have rounds. We have what they might call grand rounds or nurses rounds or health professional rounds. And some of those rounds where you come together around table and discuss issues of concern or complex patient presentations. Oftentimes here, we might have an ethical grand rounds where we talk about an ethical situation. And we have to come together and analyze, decide, and create an action plan using our code of ethics to guide our thinking. And it's a moral compass for nurses. As caregivers, we spend time with patients at the most vulnerable times of their lives. And I would state that nurses spend the most time with patients in the healthcare system. We are at the bedside the majority of the day. So therefore, we are spending the most time with patients at the most vulnerable times of their lives, whether they're ill, whether they're healing, recovering, or maybe facing their end of their life. These are all very, very vulnerable times for patients. And therefore, it's our privilege to be at their bedside. And the code guides our professional practice. It helps us to find meaning. It helps us to be present, to avoid all the distractions around us and to be present for that patient, to prioritize that situation. It also is a moral compass that guides that we bear witness. We bear witness to pain and suffering. We bear witness to death and loss and grief. And so again, this ethical code is very important to our practice. And I have to say, even preparing this lecture today for you, it actually reaffirms my commitment. And it reminds us how important it is for us to visit our code of ethics and to remain current on our code of ethics in our practice. Also, the moral compass helps facilitate healing, and express caring. So our code of ethics can help us with that as well. So today I want to talk about the International Council of Nursing, which is an international organization. It's a global community that recognizes, supports, and invests in nurses and nursing to lead and deliver healthcare for all. Its mission is to represent nursing worldwide, to advance the nursing profession, to promote well-being of each and every one of us, and to advocate for health in all policies. And they have put forth a code of ethics over the years, and they recently updated it. So they updated it in 2021. I'm going to give you a link in the next slide, in the next series of slides, that you can use and access this complete international code of ethics. But for the purposes of today, what I'd like to do, the International Council of Nursing has put together 4 elements within their code of ethics. To do that would take us all day to go through all 4 elements, but I've chosen one element, and I want to go over the statements that are associated with that element, and we can talk a little bit about those elements, about those statements as it relates to that element. But I do want you to take a look at the complete International Council of Nursing Code of Ethics and look at all 4 of those elements on your own time. And maybe in future sessions, we could talk about some of the other elements as well. But it's fairly current, fairly updated, and I hope that you find it helpful. So let me stop sharing for a minute, and I'm going to pull up a second set of slides. If you need to stand up and stretch, get a glass of water, whatever, feel free. I know sometimes sitting can be a little draining, so feel free to stretch if you'd like. Are you all hearing me okay? Do you hear me? Do you understand me, my accent and all? It's okay?
Yeah, it's okay. There is no problem.
Okay. Let me know if I need to slow down or stop me if you have any questions.
You said you need to slow down.
You need me to talk louder?
No, you need to slow down. Slow down. You're what?
Slow down. I'll slow down. I've been told that before. My kids tell me that all the time. Mom, slow down. Everyone back? You've all taken a stretch, I hope. So this again is the Code of Ethics put forth by the International Council of Nurses. So this is not my work. This is the work of a very, very prestigious council of nurses who have worked really, really diligently to establish the elements of this code. And along with the elements, they have statements. So with the first element, I believe there are 11 statements related to that one element. And they've broken it down for us, and you can see it in a few minutes. I'll get to that slide. But the purpose for the International Council of Nursing to put forth this code of ethics is to have a statement of ethical values for nurses, a statement of responsibilities and professional accountabilities for nurses and nursing students. So if you're ever with nursing students in the settings, you can also remind them of this code of ethics and reinforce the importance of this code of ethics to our practice. The purpose of this code of ethics is to define and guide ethical practice. But remember, it's not a code of conduct. It's rather an overarching code of ethics. So the core principles of ethics in health is derived from the word ethos, which is referred to as a way of living. So it's a way of professional practice. It's really core to who we are. And these are the 5 common components of any ethical code across all professions in health. So ethics in health deal with respect for persons, respect for all persons. And we see each person as an individual. No matter who he, she, or they are, we respect each and every individual. And that sometimes can be challenging, especially in healthcare when you might have a disruptive patient or an argumentative patient. We still need to remember that that patient is an individual that we are asked to care for. and as professionals, we are required to care for. We also recognize autonomy as a core principle of ethics in healthcare, that each individual has the right to making their own decisions, independence, and they can be in charge of their healthcare if they're deemed competent. Benefits, that the healthcare that we provide aims to benefit all patients and to provide care that we know is held to the standards that we've set forth by our professional practice and is guided by evidence-based practice. Justice, utility, and solidarity. And those are some of the core principles of ethics in health. So this is the entire, here you'll have a hyperlink to the International Council of Nurses Code of Ethics, and you can click on that blue link in the slides. And I'm going to provide these to Vicki and to your team to have. You can also just do a Google search for the International Council of Nurses Code of Ethics, and it will come right up. And I oftentimes use Google Scholar, which is a vehicle within Google that will get you to scholarly resources. So the 4 elements that have been set forth by the International Council of Nurses are the first one, nurses and patients or other people requiring care or services. So that's their first focus, and that's what we'll talk about today. And then they have another element on nurses and practice, and focuses on nurses. And then we talk about nurses and the profession, and nurses and global health. This International Code of Ethics as of 2021 is the current framework and guide for all nurses practicing across the globe. Okay. So here is the first element, and I'm going to give you an overview and some examples of application. The focus here is nurses and patients or other people requiring care and services. And that our primary responsibility, so statement 1, number 1 under element 1. This is their first statement of the entire element. Nurses' primary professional responsibility is to people requiring nursing care and services now or in the future, whether that be individuals, families, communities, or populations. So they use people as an individual or as a plural. We have obligations in our communities. We have obligations within certain populations and within the patient care setting within the individuals and their families. So not only are we responsible to the patients, we're responsible to the broader scope of family, community, and populations. Nurses promote an environment in which the human rights, values, customs, religious and spiritual beliefs of the individual, family, and communities are acknowledged and respected by everyone. Interesting, in this element under number 2, they talk about nurses' rights as well, to be included under human rights and should be upheld and protected. And I think we can think of this element number 2 as a very important statement about the healthcare we provide as nurses with respect to the rights, the values, the customs, the religions, and the spiritual beliefs of the patients we care for, their families, our communities, but also the rights of nurses to have healthy work environments and to be provided the supports they need so that they can provide the most professional and high quality care in each and every setting that they work. Does that hold true to you all? Do you have any reaction to that? Any thoughts? You can even jot them down and share them amongst yourselves after this presentation, and just take some time to talk amongst yourselves about these this element and these statements. But it's certainly a resource for all of you to use in your work. Nurses ensure that the individual and family receive understandable, accurate, sufficient, and timely information. I think this is very, very important in our work. I was just speaking to a neighbor here, a next door neighbor in my community, who has renal disease. And he's going to see a nephrologist. And he said to me, Nancy, who's a nephrologist? I said, well, that's a kidney doctor. And he said, well, what about my renal disease? And I thought to myself, we've used the word kidney, renal, and nephrology in the same paragraph for this gentleman. And he's so confused by what we're talking about. So I said to him, think about the renal function as the kidney function. Think about your kidney disease as your kidney disease, and think about the nephrologist as the kidney doctor. And I want to call the nephrologist and say, can you call yourself the kidney doctor? Because it's so confusing to this gentleman to understand healthcare today. And then they give him medicines, and he doesn't understand what medicine he's on. He doesn't know how to take it. So we as nurses really need to spend time to ensure that families receive understandable, accurate, sufficient, and timely information. And one of the greatest skills that a lot of our nurses are working on, and I'm sure you all work on as well, is asking patients to teach things back to us so that we can be certain that they understand the work or the information that we've provided them. But we really need to look at the manner that we deliver this information and make sure it's appropriate to the patient's culture, to their linguistic ability and language, their cognitive ability, and their physical needs and psychological state, on which to base consent for care and related treatment. Think literacy. Always think literacy. Did they understand? I oftentimes ask my nurses students to imagine, particularly when they're working in geriatrics, to imagine speaking to their own grandparents. And that actually helps them frame their thinking. And I think in healthcare, even working with other healthcare providers, when we're talking about a person's health, there's an awful lot of fear and worry. And oftentimes they're not at their best understanding what we're saying. So we need to write it down for them, to reinforce it, and to really support people in understanding the complexities of the healthcare that we're delivering. I think about a lot of the consent forms we ask people to sign for surgery or for procedures or for any research studies, and they're very complicated words that we use. So when I think about talking to patients, I really ask them to tell me back what I said so that they can teach me and I can make sure that they know what I've shared with them. That teach back method is really helpful in this situation because it really is part of our code of ethics to really make certain that families receive understandable, accurate, sufficient, and timely information. Any thoughts, questions? This can be time consuming.
Yes, I have a question.
Sure.
From adult research. It's not really a question, it's like a fact. Like you are talking, and this element of ensuring that the individual and family receive an understandable and accurate information. It's really necessary and important because this helps allay the fear of this patient for most procedures. Like mostly in the resource where I'm presently working, there is this feeling that patient or their relative gets when they see their relative or their patient on an oxygen apparatus, or be it the nasal cannula or the simple face mask or the non-needle mask. So these procedures, if it explain to this relative that okay, this patient is in a distress, is unable to breathe normally or accurately for him or herself, but with this apparatus given to him or her will help him regain his normal way of breathing or regain his normal saturation. With this, the relative, the patient will be comfortable and there will be no fear in them whilst their patient or such procedure. So this is a fact that we are seeing here, and when you do the accurate or you give a sufficient explanation or information to this patient and the relative, you really of the result of such procedure that we've done. Thank you.
Thank you. That was a very well stated summary of this. It's so important. I actually think it really helps them lower their fear, lower their anxiety, and it really helps them understand what's going to happen. And as you noted, the family understands what's going to happen. So when they leave the room and you're doing the procedure, the family can have confidence and can have, I hope, a lower anxiety about what's happening. You know, very well stated, very nice summary, and very essential. As you can imagine, I teach with children. So I work with children. So when I explain things to children, their parents listen to me explain it to a young child. And I find that the children really understand, and the parents equally understand, because we're addressing a much lower level of cognitive function. And so it's really interesting to see the pediatric role of teaching. Welcome.
Hello.
Hello.
Yeah, Alicia's laid out that from observations. Pertaining about these elements, section 1, element 1, section 2, promote the right value and customs. My issue here is all values or customs of these patients' relatives that brought in the hospitals may be allowed in the hospital facilities, because there are certain of values that brought at the hospitals. We allow them to be harmful for the patient. I don't know. I want you to clarify this area, this value and customs.
So you're talking about the hospital environment and that it's not allowing something? Is that what I couldn't hear it all. It goes in and out a little bit.
Just from the content, the spiritual belief, like the value, customs, or spiritual belief. Because there are certain spiritual beliefs, this family practice to be harmful for the patient. So to promote this spiritual belief or customs or value, there are these areas. I don't know. I want you to clarify.
Well, that is a complicated and complex topic. And what we do here in the United States and in my practice, I shouldn't say across the United States, but in my practice, if we have, I believe what you're asking, if someone has a spiritual belief that might be harmful to their health and well-being, is that what you're worried about? Yeah. You know, we need to educate them based on the practice and the professional guidance that we know. And so we share evidence-based practice with them. And we do our very best to inform them of the evidence and why we believe the treatment or the plan of care that we have set forth for them is ideal for them and is in their best interest. We oftentimes want to acknowledge their spiritual beliefs, but we want to provide them with enough knowledge based on the evidence and based on our medical and nursing, principles and our science to try to do our very best to inform them and educate them. In most situations like that, we pull together an interprofessional team. We will have a physician. We might even have someone from their religious background help us or if we have someone who they might trust with their religious background, help us in guiding that. So it might be a nurse, a doctor, a social worker, a minister, or someone from the hospital that would help us in addressing that, because that's a really complicated topic and a complicated situation to deal with. I know in some situations when someone refuses care because of their religious beliefs, I know here in the United States, we do our very best to educate them and guide them, but if they refuse, we might have them sign a waiver against medical, that says that they understand that they're not abiding by the practice and the medical advice that has been provided to them. But that's when we would involve the hospital administration and leadership to guide us there. But in most situations, we do our very best with the help of an interprofessional team to address their spiritual beliefs, to acknowledge them, to not dismiss them, but to provide them with the evidence for why we want to practice the medicine and the nursing practice that we believe and we know and we have evidence of is best for them at this time. Nicole, any thoughts on that?
Once again,
I think that
Thank
you
you.
have to, like, we try to really work with the patient, and so it's tricky to identify like what is harm, right? Like I know, like for instance, in some Asian cultures they do cupping, and so what we might perceive as harm because there's like welts on their back is maybe not truly harm. So I think it's like really important to first make sure that that it is truly harm, and that it's not just like us coming from a place of not understanding a cultural practice. So always coming from a place of understanding and working with the patient and their family to sort of work together, because what we found is that if you just say, no, you can't do this, and it's part of a patient's real core spiritual belief, they're likely going to do it anyway. So I think it's really important to work with the patient to really understand what the practice is all about, and maybe finding a compromise.
Thank you. Thank you for the question. And thank you for your attention to this very complex code of ethics. So let's go to number 4. This fourth statement says that nurses hold.
We might have lost them. I don't see them here anymore. I think we might have lost internet connection. I don't know if we want to give it a moment and see if they come back.
Oh, sure.
I'm just going to pause the recording.
And let me talk to them.
Can you hear us now?
Sorry, we had a break
No
in
worries.
the internet connection.
No worries. I hope you heard what Professor Myatt shared, that it really is important to respect the spiritual beliefs of that patient, to try to hear them and to honor them, but to do it within the reason of finding that balance and abiding by our nursing practice and the standards of care that we set forth, but doing it with respect to the individual and the family. So element 1, number 4, really talks about the very important concept of confidentiality and privacy, and that we hold in confidence personal information, and we have to respect the privacy and confidentiality and interests of patients in the lawful collection, use, access, transmission, storage, and disclosure of personal information. Very, very complex concept here. But again, I think it's vital that we all spend time reflecting on the amount of information we have access to as nurses on each and every patient we care for. And I know here in my work setting, can you hear me okay?
Here,
Hello, Nancy.
then tell them to meet. Can you mute your mic, Mary? Come. Okay, done. Nancy,
Yeah.
I'm having here like a concern when it comes to talk about privacy to our client, our patient. But sometimes there are procedures that we do. For example, we are in the theater performing a cesarean delivery. even if it's a privacy from people from outside, but you can see a member of team, healthcare team who is assisting. We have like a neonatal nurse, we have anesthetist, we have like a gynecologist, we have also midwives who are performing. Is it really, can we say that their privacy is not respected according to the condition where we are working?
So we are allowed to share information about patients with other health professionals in the window of caring for that individual, but not outside of that. It has to be within the framework of caring with the individual. So it's really important that we hold confidence with personal information about our patients and their families, and we respect the privacy and confidentiality of the patients in the lawful collection of use, access, transmission, storage, and disclosure of personal information. So if we have an interprofessional team meeting, we certainly will share with one another the healthcare information that's relevant to the decisions and to the care that we're providing. But we need to truly respect each and every individual patient and family's confidence in the broader scheme. So I know in our healthcare settings, we have signs posted in our elevators and in our hallways that remind healthcare professionals that when they're traveling within the units and within the floors, they cannot speak about patients outside of that healthcare setting because other people might be in the elevator with us. Someone might be in the staircase with us. And so we have to be very cognizant and very respectful of each and every patient we care for. And we have laws that govern the transfer of information between professionals. And our law here is called the Health Information Privacy Protection Act. We refer to it as HIPAA. And so when we even do any sorts of transfer of records, we have to be very, very careful to only transfer the records between the healthcare professions that are requiring access to this information. And we need to inform our patients of the transfer of information and get signed consent from them that they would allow us to transfer their information from one doctor or one healthcare system to another. Is there a question?
Yeah, it looks like there's a question.
Yes, please. So we had a break in the network, the internet connection. So we would like for you to go back to 1-3, please, where we stopped.
Okay.
For the break.
Okay.
Thank you.
So 1-3, I believe, really focuses on healthcare literacy and making certain that families and individuals understand the information that we provide. And that when we provide information to patients and families, that we as professionals regard the person's culture, linguistic ability, cognitive abilities, and physical needs and psychological state on which they would consent for care and related treatment. So this is where we really focus on the words that we use, the level of the patient's understanding of what we're telling them. And I use the example of a neighbor here who's got some kidney disease, and he's hearing words like renal and nephrology, and he's very confused, and how we as nurses need to attend to trying to simplify this language and simplify the complexities of healthcare in our education to our patients and to his family. His wife continues to come back from the healthcare setting and says, I don't really understand what's going on. I don't really know what to think. And I just feel for her because she's finding it so overwhelming to understand. And one of you shared so eloquently how important it is to teach your patients clearly and precisely what they need to know. And the one example, the one tool that I would share with you that we use, and I'm certain you're familiar with, is asking a patient to teach back to us what they've learned. And that assures us that they understand what we've said. and then to write out some simple instructions. Simple. Okay. And then we'll move forward. Is that okay to move to 1.4 now?
Yes, yes.
Okay. And this is what we were just talking about with privacy and confidentiality. And when we're in common spaces like the cafeteria or in the hallways or in the elevators or wherever we might be in our healthcare systems, we cannot speak freely about the patients we're caring for. Because again, someone might be in the area and could overhear our conversations. So we really have to pay careful attention to where we hold the confidences of our patients and where we share. We certainly talk to our healthcare professionals. We share with other nurses when we report. We might ask other nurses for their opinions or their professional guidance. We might look for a mentor or a physician or a therapist to help us in deciding or in providing care to that patient. That's within the trusted network of sharing confidences. But what we really need to be certain of is that sharing any information outside of that core medical team caring for that individual, that we really respect the privacy and confidentiality of the patients, and that we don't transfer information across healthcare systems without the clear permission of the patient and their family in some instances. And when we store information, that we store it safely and under lock and key so that it's not available for anyone to access. And you need to understand the rules that govern practice in your healthcare setting. And I'm sure there are rules that are put forth from your healthcare organization as to how we store healthcare records in the healthcare system. But we have overarching rules here that guide us. And I mentioned the Healthcare Information Portability Privacy Act, HIPAA, here in the United States. And that guides the transfer of any information. And we need to get HIPAA permission and HIPAA approval and all sorts of HIPAA regulations about transferring any sort of medical information between institutions. Okay. So let's go to the next one.
Yeah, thank you. We have in the chat room a message from the group saying that they did not understand well about the previous slide, point to element 1, number 3. They want you to go back on element 1, number 3. Thank you.
Okay.
That has been done already, Beata. It has been done.
Okay. I actually think that's very important. So if anyone has questions about that, I'm happy to go back to it. But literacy is so important. And so please pay careful attention. There are a lot of good resources on literacy in Google Scholar on how to educate and speak to patients. So this is the 5th statement under element 1. And this is respecting the privacy and confidentiality of colleagues, so of our fellow nurses, and of people requiring care, and upholding the integrity of the nursing profession in person and in all media, including social media. This is really important. This is new. You know, for the past 10, 15 years, the introduction of all of these different social media platforms. We as nursing professions cannot post on social media anything to do with our professional practice. And that includes the privacy of our fellow colleagues, including physicians, other nurses, interprofessional team members, and the patients that we care for. And we have to uphold the integrity of our profession. We as nurses see ourselves as professionals, and we hold ourselves in the highest regard. And as I shared with you, we have the public trust. So we need to be very, very thoughtful of the nursing profession in person and in all media, including social media. So there's no posting on Facebook, Twitter, Instagram, or other platforms, any information about patients, families, or colleagues Do not disparage the nursing profession. That hurts all of us. And it's just ethically wrong. We need to respect the privacy of each and every individual we care for and their families. I think we could stay right on this slide for another.
There's a question, Nancy.
Sure.
I am Lady Kama.
Nice to meet you. Pediatric?
Yes. So
Hello.
I wanted to ask, what's your take on nurses doing TikTok, wearing their uniform, dancing on TikTok, Facebook?
You know, I think this element and this statement here would not want us to be wearing our uniforms on a social platform media or a social media platform, because I think it might send the wrong message. I think I'm not as familiar with TikTok, but I think it would depend on the content and the purpose for that TikTok post. If it was health education separate from nursing profession or within the nursing profession, it might be reasonable. But I think if it was more of a skit or something more entertaining, it would not be the correct platform. I know that Twitter and some of the social platforms have been used for education and used for access to things like the COVID vaccine and promoting where to go get the COVID vaccine. That's very different than any other use of the social media platforms to at all disparage the nursing profession. So I think it would really depend on what the purpose of the TikTok film was, or purpose of the TikTok clip was. But I'm not a big fan of putting out the nursing uniform and professional presence on social media unless it's done with the utmost caution and respect for health education and nursing practice. What is your thought?
I think you are just thinking what I'm thinking. I think it's so wrong for nurses to be wearing their uniform, dancing on TikTok, having this kind of music. I've been seeing it on social media, and I don't think it's a nice thing for them to be doing.
Yeah.
And even going viral on Facebook, nurses are doing this. I don't think it's actually okay.
Yeah. Thank you. Thank you for the question. I think you could even reference this element and this statement if you were ever to talk to a colleague about not doing that. I think we have these guides that can really strengthen our approach to this. Again, I'm not saying all or every, I'm just saying that in situations when we're using social media, we have to be very attentive and be cautious not to disparage our nursing profession. Hello.
Yeah, I'm Hawa Fufana from isolation. In this slide, like we are talking about privacy of the patient, but we nurses, we normally prevent the patient from their relative, normally when they came to visit. But in this case, most relatives that came to visit the patient, they normally took phone to take a picture of the patient to share it with the relative. I don't know if that is accepted or what.
You know, it's a really interesting question. And I think what I might encourage you to do is to talk to the patient themselves and ask them that if they're comfortable with their family taking a picture of them. That's almost an interpersonal discussion between the two family members as to how to handle that. You know, a nurse taking a picture of a patient would not be acceptable. That would not ever be acceptable unless it was done for medical purposes only and under the agreement of the entire medical team and with permission of the patient. But I've never seen that except in maybe a situation with dermatology and a very unusual rash or something like that. But I think if a family member wants to take a picture of a family member who's a patient, I, as a nurse, might just check in with that patient and make certain that the patient was comfortable with the pictures being taken. And if that patient's not comfortable, then I might help that patient and address the family and say, this is not an appropriate time to take a picture of your family member. But I don't think there's any guidelines as far as nurses within, you know, if it's a family to family situation, it's within the family. But we want to respect the privacy and confidentiality of the patient themselves as nurses. Professor Myatt, any thoughts on that?
I think this is something that like still needs to be developed as social media like has become so pervasive in our lives. I personally don't participate in social media, but I know for this next generation to tell them not to do that is almost to tell them not to drink water, you know? So I think that we almost need to flesh out better like guidelines for how to participate in social media in a way that's still reflective of the respect that our profession deserves.
Thank you. Thank you. And again, I just want to remind you, I think it's our responsibility as nurses to, again, respect the privacy and confidentiality of the people we're caring for. And so we need to make certain that that patient is comfortable with what's happening if family members are doing things. And we can advocate for those patients. And we can say, you know, this is not comfortable. I sometimes ask patients' families to leave the room and I talk to the patient alone to really check in with them and to let them know that I'm there and I can advocate for them. So I would encourage you to consider the situation and to speak with the patient themselves. I also am not on social media. Nurses share with society the responsibility for initiating and supporting the actions to meet the health and social needs of all people. Nurses share with society the responsibility for initiating and supporting action to meet the health and social needs of all people. And in the course that I teach on health policy, we see health in all policies. And we see the nurses as trusted healthcare professionals that can serve as strong advocates and champions for not just patients, but for our communities and our populations. I attend community meetings. I stand up at hearings about the environment, about school health, about access to green space and clean water and safety. I speak out against gun violence in our societies. We're champions because we're trusted healthcare professionals. And we need to support our communities and the health of all people. And this again is element 1, number 6. Are any of you active in your communities? Anyone want to share? I'm sure you're all active, but anyone want to share an example of their advocacy within their communities?
Anybody involved in outreach or something with them? Community outreach?
Yeah, so partake about outreach.
Yeah, I can share.
You can share with one another. You don't need to share out loud. Just share with one another what sort of advocacy you do within your communities or within populations that you interact with or encounter.
Yes, like hello, good afternoon. Hawatiwa Kokowai from the Adults Resource. So again, talking of we the nurses being an advocate and champion for patients, community, and population.
it's really effective and we'll have a good outcome if we really focus on it. Like currently in Sierra Leone, we are looking at the World Hepatitis Day, which will be like July 28th, I think. So there is for KGH, there is a set group, which is the Cordon Medical Outreach team, wherein every week we do go to the media to talk on different health problems, because we want to create an awareness for those people to stop going to these pharmacies, going to those herbalists. So we are really creating that awareness. The advocates will really help in creating the awareness for those people to be coming to the hospital whenever they have any symptoms, because different disease conditions might have similar symptoms. So if you've been treated for a particular disease condition and you've started having the same symptom, it might be another disease condition. So we really advocate to them, we advise them to come to the health facilities. And like for Africa, you know, people really believe in this black magic. And when those symptoms of different diseases happens to them, they might take it like it is being done to them by somebody else. But if it's really been explained to them, for them to be coming to the health facilities, I think will help in saving those lives before it's too late.
Thank you. Thank you. Thank you. I think using the media is so creative and so important, and well done. Well done. But I think educating patients about who you are and what they can get when they come to healthcare and caring for them and letting them know you're there for them, very, very important. So well done.
Yeah, I'm Kumbagadi Mweo from Med Surgical Work. We also have a unit, AYFS, which is the Africa Youth Friendly Service. This unit is responsible to go out to different schools, sensitizing the girl child, sensitizing the females in early pregnancy, early marriage. I think these have helped a lot from our own side. The girls, they are now aware that education should be a priority to them, not early marriage or early pregnancy.
Yeah, I'm Alice Arona. Not only the community, even in the hospital setting. So me, I'm working at main medical ward. Sometimes some patients come, they don't have no relative with them. So we advocate for them by meeting the social worker, explain to them about the patient condition, and they see reason. We advocate for them for medication and even food. So we've done that in our own setting here. PIH help in that one.
And advocating them with their families and what they're expected to do. So I think we can be champions. I think, you know, we need to recognize that we're a profession that is respected, that we have earned the public's trust, and that we're uniquely situated to be champions of health and health in all policies. I'm sure some of you might have children in schools, and I have always been an advocate at the schools to assure that the students get great educations and strong educations, because I know a well-educated person is oftentimes prepared or equipped to take good care of their health. And so I believe education of children through the grammar schools is vitally important, and through primary education. So we can be champions not just of health and healthcare delivery, but of other systems in our communities that promote population health. And we can advocate for justice and for what is right. And we can advocate within our communities at that level. So next slide. So again, this speaks again for equity and social justice in resource allocation, access to healthcare, and other social and economic services. So we know that in some situations we provide care outside of the healthcare system, but even within our healthcare systems, we need to make sure that we're equitable, that we provide access for all, and that we look for resource allocation that is fair and just. We should be developing position papers as nurses And we should be talking about the standards of practice and guidelines that support human rights, rights of every individual, every human being. And this is very, very important as a part of our ethical code, that we advocate for healthcare equity and social justice. And again, as those who are providing care, for those of you who might work in the emergency room and might see various people coming in each and every day, you are the eyes and ears of healthcare, and you can be the unique advocates for social justice and equity, making sure everyone gets the care they deserve. And then the 8th statement talks about demonstrating professional values. So again, I bring us and I raise us up as nursing professions, and I hold us in the greatest professional esteem. And we talk about values such as respect, justice, responsiveness, caring, compassion, empathy, trustworthiness, and integrity. Think about the power of those words: respect, justice, responsiveness, caring, compassion, empathy, trustworthiness, and integrity. It gives me pause to be a nurse. You think about the responsibilities we hold and the trust that the public has in us. And that translates to every patient we care for. They come in knowing that each and every one of you is going to do your very best to provide professional care to that person. Nurses support and respect the dignity and universal rights of all people, including patients, our fellow colleagues, and families. And how they interpret this is they ask us to consider nurses as providing people with culturally appropriate care that respects human rights and is without prejudice or unjust discrimination. So I would ask you to just jot down some of those words: respect, justice, responsiveness, caring, compassion, empathy, trustworthiness, and integrity, and hold those close to you as you go out and practice in the nursing profession. I feel it has been an honor of my lifetime to be a nurse, to have patients allow me as an individual to guide them through their health and well-being, to be with them during their most vulnerable times. I have, for those of you who work in pediatrics, I have sat with parents who have watched their young children suffer through illness, and they trust me and you and our colleagues to care for them. It really is a privilege to be in our profession and to be caring for patients and families and colleagues. I think that's a very powerful, powerful statement. The 9th statement talks about facilitating a culture of safety in healthcare, recognizing and addressing threats to people and safe care and healthcare practices, services, and settings. And this is becoming something that I think post-COVID we've really paid attention to, because the healthcare system was inundated, and there was a lot of, here in the United States, we had a lot of unsettledness about the vaccine and the care and what we were doing, and then the people didn't understand COVID and the virus. And so we really need to facilitate this culture of safety in healthcare environments, that people are protected and that we are caring for them, and that nurses and healthcare professionals are also safe. And we need to recognize and address threats to people in safe care and health practices, services, and settings. We need to work to create and support a healthy and safe workplace for all of us, particularly our patients and ourselves and our colleagues and our other interprofessional colleagues, to promote a workplace that's safe and free from injury and harm. And I wonder if you think about your healthcare setting and what you're doing to promote safety within your healthcare setting. We have more thoughtful discussions and some policies coming out now regarding patient safety and regarding nurses' safety and provider safety. And it's really important that we have safety in our healthcare setting. We all need to feel free and safe and able to care for these patients without pause. So it's important that we be a part of that and we facilitate that culture of safety. And we advocate for safety. Nurses provide evidence-informed, person-centered care, recognizing and using the values and principles of primary health care and health promotion across the lifespan. And I think this goes back to that question about what do we do if we have a patient who might disagree with our health care or with the care that we're providing? And how do we promote their acceptance of our healthcare? And we need to let them know that our healthcare is evidence-informed, that we've used research and we've used science to inform a very, very strong approach to the healthcare of that patient. And that the healthcare that we provide is person-centered. And we recognize and use the values of primary healthcare and health promotion across the lifespan. And then the final statement of this element is that nurses ensure that the use of technology and scientific advances are compatible with safety, dignity, and the rights of all people. We are now encountering artificial intelligence and devices such as robots and drones. And nurses need to ensure that the care remains person-centered and that such devices support and do not replace human relationships. And the International Council of Nurses in 2021 put forth this statement, knowing that the future holds a lot more advances in technology. We need to be involved in technology. We need to know what's being developed. If we are going to use any of these new scientific innovations, we need to be a part of it. And I would ask that we be at the table, at the decision-making table about how we use this in healthcare. Remember, nurses provide the most, the highest hours of person-centered care at the bedside of all health professionals. We are at the bedside. We need to have a voice in the decisions about how technology is used. We would see how it works each and every day. So we need to be involved when technology is developed and observe and report the risks with technology and scientific advancement. And that is the end of that slide presentation. So I'm going to stop sharing for a minute. We can take some questions, and then I have one final slide presentation to go over quick. It's a few post questions. So post-test questions of today's presentation. And I didn't give these to you intentionally because I want to see what you think. They're very, I didn't go too hard on these. I wanted to make these, you know, available to all of us. Need to take a stretch? You okay?
Yeah.
You're listening well. I know I'm talking a lot. So let's do the first question. Which of the following are core principles of the ethics, of the code of ethics? You can add E, all of the above?
All of the above.
You can choose more than one. So we would all agree A. A and C and D. B, authority is not a core principle of the ethical code of nursing. So it's A, C, and D. Respect, autonomy, which is also seen as independence, and benefits. Authority is not a core principle.
Respect, independence, and beneficence.
Let's go.
So the nursing code of ethics is a code of conduct. True or false?
False.
Very good. It is not a code of conduct, and that is specifically written out by the International Council of Nursing and other professional organizations, that the nursing code of ethics is not intended to be a code of conduct. It is meant to be a guide for our conduct and a guide for our practice, but it is not a code of conduct.
Yeah, Professor, a question.
Yeah.
Another question here. Professor.
Yes.
Yes, I have a question here. I'm Mohamed Momo from SCBU, Social Baby Care Unit. So, under the scope of nursing, you write there that nursing ethics is deal with character and conduct. Now, under the other written, you write there it is not a conduct. Can you please explain for us?
I see, you know, on that slide, it does define it as a code of conduct, but the International Code of Nursing, and I mentioned that in my presentation, it is seen as a guide for conduct, but it is not a code of conduct. It is a code of ethics that guides our conduct. But I do note that slide that you're mentioning at the very beginning, it has been seen as defining as something that would be a guide to our conduct, but is not, by the International Code of Nursing, it is not seen as a code of conduct. I believe it would be the healthcare organization that would write out a code of conduct. And I believe it is at the system level that a code of conduct would be put forth. So I see the confusion, and I do note that slide that's earlier, but it is specifically stated in this by the International Council of Nursing that it is not meant to be read as a code for conduct. It's much more of a code that is seen as a guide and an overarching guide for us as professionals. So I will edit that slide because you're correct. I should make certain that I don't confuse it. And then where can a nurse find the Nurses Code of Ethics? Would it be by the World Health Organization, the Nursing Board of Registration at the state level or at the country level, the International Council of Nurses, or peer-reviewed journals? C. And I really do encourage you all to go onto that website. And it is a lengthy document, the Code of Ethics, and it will go over all the different elements. So I do encourage you to examine the International Council of Nurses Code of Ethics. It's very, very well done. It's very up to date. It's very current. And I think it's essential that we all have familiarity and that we revisit this on a fairly regular basis. It's actually been very helpful to me to prepare to meet with all of you today and to work on this presentation, because it reinforces my knowledge of the Code of Ethics as well. So sometimes teaching is a gift. It really is. And I thank you all for your time today and your attention. You've been a wonderful audience. So my final question is, what is your takeaway from today's presentation? And that's open for all of you to discuss. So let me stop sharing because that's my final question. So what's your big takeaway from today?
Yes.
Sure.